this is Janice Lopez from the International Organization for Migration, and welcome to the Migration Health Research Podcast. In this issue of the Migration Health Research Bulletin number 20, we feature research articles, reports, and commentary pieces on relevant migration health topics such as reproductive health, mental health, and COVID-19 in the context of mobility. For this audio podcast episode, we spoke to Michela Martini, IOM's Regional Migration Health Specialist for East Africa, about women refugees' access to maternal health services in Kenya. Let's listen to Michela Martini.
The study was conducted by IOM in collaboration with the Aga Khan University here in Nairobi. And the study is looking at the impact of COVID in access to and utilization of antenatal care, delivery, and postnatal care of migrants, women, and refugees in urban area of Nairobi. When we are thinking and looking at maternal care and pregnancy outcomes, there is a global understanding that migrants women are amongst the most vulnerable groups. They are likely to experiment adverse pregnancy outcomes. They face lots of barriers for information and access itself to the services for many combined factors. The increased understanding of maternal care during COVID, we thought it could help IOM, but also other stakeholders working in urban area to identify existing gaps, but also inform potential intervention that could improve the uptakes of services during COVID, but also beyond the COVID. Our study intends to provide also a scientific evidence of study coming from Africa. During the pandemic, there were not many studies about how migrant women had experimented access on maternal services, but also the impact in healthcare frontline serving them. In addition, we also know the studies from Africa, they are always underrepresented in the global research of migration and health. So this study is intended also to provide a contribute to the science-based information to generate solid data from Eastern Horn of Africa to inform a real evidence-based policy and programming.
Given all these study objectives that you have just shared with us, can you also share with us or walk us through the research methodology that you have employed in this research?
The study was conducted in Eastleigh, which is an urban area of Nairobi where IOM is running a primary healthcare clinic serving an average of 3,000 monthly consultations. Eastleigh is mainly populated by migrants, including and actually most of them are undocumented and working in informal sector with occasional employment opportunity. And the study applied a qualitative method and with 40 in-depth interviews. We recruit facility staff and community healthcare members. And also we interviewed women attending antenatal care, postnatal care in October 2020.
Michela, at this point, I would like to ask you to share the findings of the study that you think would be relevant to our listeners right now.
I think the most important finding is that our study suggests that within the first 8 months of the COVID pandemic, there was an increase of home deliveries in the women in the Eastleigh community. But also in parallel, our health facility has observed a decrease of access in utilization of services and delay of maternal care. In the context of COVID, of course, we know, and it's well documented, that continuity of services was a bit challenging, and all the services, specialized services, had been impacted by a reduced access for many reasons. In our study, it was a combination of factors. For instance, the fear to be infected by COVID at the health facility, but also they felt our beneficiary to be more discriminated during COVID because of the linkages of COVID with migrants, that sometimes they were labeled as a carrier of COVID as well. But also an important barrier was lack of financial resources. Some of the women we interviewed, they could not afford to buy masks or to go to the health facility or afford the private health facility where they thought maybe infection protection control was safer than other clinics. And another important barrier was a lack of understanding of migration inclusive policy to allow also regular migrants accessing services. So was also another important factor. So many regular migrants women, they were in fear to be either deported or to be reported to the police. Those were mainly the key element influencing home delivery.
What do you think is the main implication of the study for a policy or program, especially in Kenya?
Due to the context where we conducted the study and due to the poor housing standard, the poverty level of the population, but mainly the lack of sanitary equipment, clean water access, home delivery, it's very dangerous. It may expose women and their babies to contract many infections in addition to COVID. There is the need, in our view, to revisit the current maternal care policy and invest a little bit more in sensitizing the community health workers to allow the migrant women to receive equal treatment than host population and make them safe and in trust to access maternal care services without being discriminated against. And on a broader range, I think this study is touching an important advocacy message that also IOM is bringing forward, which is the inclusion of migrants into a health service plan. And looking at the countries, African countries, and the ongoing dialogue on universal health coverage, we also hope that this study it will contribute to positive advocacy toward the progressive inclusion of migrants in all the national health plan and as a priority, the maternal care.
Thank you very much, Michela, and thank you all for listening. Please feel free to share feedback with us. See you on the next podcast.